Good morning. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We are here to give a COVID-19 update. You'll be hearing from me as well as Dr. Arwady and Luna from the Chicago Department of Public Health, CEO Martinez of Chicago Public Schools, and Ken Meyer, Commissioner at the Department of Business Affairs and Consumer Protection. So first of all, we are, as you all know, very much in the Omicron surge here in Chicago. I'll share some data. When we look at our community transmission and risk matrix, we continue to be in the very high transmission category for cases, averaging now over 4,500 per day. We also have a test positivity of 23.6% in the city of Chicago. Our hospital non-ICU numbers are in the high transmission range, and I'll show you the details in a minute. And our ICU numbers remain in the substantial transmission range. To look in more specifics at these numbers, the news is not good. The COVID case rate in Chicago is the highest it has been since the beginning of the pandemic. The current average case rate is 4,591 cases per day, and on December 28th, we had 7,443 cases reported. Obviously, some of that is in the setting of high testing after the holidays, as well as many more children being tested looking ahead toward the return to school, as all of our schools have returned to school here in Chicago this week. Similarly, if we look at our positivity, it is also the highest it's been since the first wave of the pandemic at 23.6%. I do want to give you some perspective that this is similar to what is being seen around the country with the Omicron variant. New York City, for example, has a 34.9% positivity right now. Even parts of the country that are in, that currently are in less of a surge have 14, 15, 20%. And there are counties in the country that have a 50% or more positivity rate. I want to be clear that some of this is because of changes that we are seeing in testing. With much more home-based testing available, most of those negative tests especially don't end up getting replicated, don't end up being reported. And so we are more likely to see people with symptoms more likely to be positive in the formalized testing. Similar patterns around the country, nevertheless, a sign of obviously high positivity. I also want to highlight that our non-ICU hospital beds that are occupied by COVID-19 patients are at the highest census in Chicago since the beginning of the pandemic. We are currently averaging 1,142 people in the hospital, non-ICU, with COVID-19. I'm going to show you in a minute that most of those people are the people who still are not vaccinated. Our ICU hospital numbers are at the highest census that we've seen since December 2020, our last surge. You'll note that the ICU numbers are quite a bit lower than what we've seen earlier in the pandemic. Some of this is because we've gotten better at treating COVID, frankly, learned more about it. There are more treatments available. But again, the huge majority of people who are in the ICU right now in Chicago with COVID-19 are not yet vaccinated. So let's look at a little bit of the background behind this. I am still reading misinformation on the internet, people saying this vaccine doesn't do anything to help protect against COVID-19 infection. Not true. Vaccines remain highly protective against infection, though Omicron variant is leading to many more breakthroughs. If you look at this graph here, the red line are the cases, our weekly rate for people who are unvaccinated. The light blue is people who are vaccinated but not yet boosted. The dark blue is people who are vaccinated and have a booster. Do you see right around that week of 11 December there, we start shooting up in all three categories? That's when Omicron really started to be here for real. And you see a major shift in cases, and that's the surge we are all feeling right now. But please note that big gap between the red line and the two blue lines. So just since Thanksgiving, unvaccinated people here in Chicago continue to be diagnosed with COVID at more than twice the rate of unvaccinated Chicagoans and 3 times the rate of vaccinated and boosted Chicagoans. infections. So yes, we're seeing more breakthroughs. Most of those are very mild with Omicron if people are vaccinated and especially boosted. But nevertheless, vaccine remains the most important thing you do to protect yourself against infection. Similarly, if we look at hospitalization, this, of course, is what I am watching the most closely. The fact that we are seeing these high hospitalization numbers is the thing that gives me the most pause. As you know, just on Monday, the requirement for vaccination in certain public spaces went in, and we're going to hear from Mr. Meyer about that. The reason we've done that is because getting people vaccinated is what protects the hospitals. If you look at this, vaccines continue to protect beautifully against COVID hospitalization, and boosters clearly add to that protection. So again, the red line, unvaccinated Chicagoans, the light blue vaccinated, the dark blue boosted. And since Thanksgiving, the unvaccinated in Chicago hospitalized with COVID at 5 times the rate of vaccinated Chicagoans and 9 times the rate of vaccinated and boosted Chicagoans. There are many, many hospitals around this city with 90% plus of the people in the hospital and in the ICU with COVID still not vaccinated. Our death increase, we're currently averaging between 8 and 9 deaths a day, much, much lower than we've seen earlier in the pandemic. That increase up from the 2 to 3 we were seeing just a few months ago is also very much driven by unvaccinated Chicagoans there in red. So similarly, just since Thanksgiving, as Omicron started to get here and really took hold, the unvaccinated have died at COVID at rates more than 5 times those of vaccinated Chicagoans and 9 times those who are vaccinated and boosted. So if you're hearing these numbers and you're still not vaccinated, right now is the time, because Omicron for people who are not vaccinated and boosted is not very clearly nothing to worry about. It is putting people in the hospital and it is putting people in the ICU. I also want to talk about what we're seeing in children. I know there's a lot of focus on schools right now. As you know, all of our schools here in Chicago, by and large, are back this week. Whether you're talking about CPS, whether you're talking about charter schools, whether you're talking about the Archdiocese, the Lutheran schools, the Orthodox Jewish schools, we of course are seeing many disruptions related to operational needs. We've seen some schools flip. We've seen sometimes some additional need for time for testing. As you will hear, CPS is testing in every school this week, and you'll hear details around that. But what we saw is, as expected, with increased post-holiday testing, Chicago children who are in the dark blue line there, age 0 to 17, we saw that increased COVID case diagnosis rate. Let me be very clear. That increased case diagnosis rate is not when children are in school. It is because of holiday gatherings and the surge that we are in community. The push to make sure that children are getting back into testing regimes is what is driving that increase, and it is exactly what we would expect because it goes along with vaccination rates in children. Very good news, and I want you to hear this really clearly, because one of the things I'm hearing the most misinformation about is that Chicago hospitals are filling up with children, that many Chicago children are dying of COVID, that it's a really scary time to be a child right now with COVID in Chicago. And I want you to understand that while, of course, we are concerned about the rise in hospitalizations, that is being driven by unvaccinated adults. Child COVID hospitalizations remain very rare. Across the whole city, approximately 550,000 children. We are averaging just 7 COVID hospitalizations a day right now for children aged 0 to 17. Again, that's that blue line in the bottom. And you can see going across, this is over since Thanksgiving. And the highest remain in people over 80, over 70, and going down from there. To put a little more context on this, because people were asking for numbers around this, very few Chicago adolescents and even fewer younger and vaccinated children have been hospitalized recently. So again, we look since Thanksgiving. Since Omicron has been here, we've been seeing this surge. 55 total COVID hospitalizations through December 29 in children. 55 over that month. And 46 of those were unvaccinated. So if you look at this graph here, the light blue solid line is the rate in unvaccinated children 12 to 17. That in the few cases where we are seeing hospitalization is generally what we are seeing. The dark blue solid line is our unvaccinated 5 to 11, still extremely low, 3 per 100,000 per week being hospitalized, very low. And then the two dotted lines show you the rate of hospitalization in vaccinated 12 to 17-year-olds and vaccinated 5 to 11-year-olds. I want to highlight that we have had no hospitalizations in vaccinated 5 to 11-year-olds to date. We have also had no deaths in children over this time period. So again, the most important thing that you can do to keep your child safe, your family safe, schools open, is for everybody to be vaccinated, kids definitely included. One more piece of context on this. Oops, how does this compare to influenza numbers, right? Like some people have said, I don't really know, it's 55, is that a lot of hospitalizations? How does this sort of fit in? So we pulled for you the numbers on what we've seen, not last year when we had an unusual flu year, but in the 2 years before. We estimated how many children, 0 to 17, were hospitalized with influenza. So 2 years ago, 2018 to 2019, approximately 188 children hospitalized with influenza during the season, running roughly October to April, as you see. Similarly, the next year, a little worse year, 2019 to 2020, estimate 232 children hospitalized with COVID between that October and early April period. For comparison, between this last October 30 and April 3, 2021, the approximate flu season, which included last winter's COVID surge, to be clear, in Chicago, we saw about 19,000 children be diagnosed with COVID and 231 COVID hospitalizations and no deaths, actually, during that period. And so broadly, COVID is behaving like the flu in children. I wish it were behaving like the flu in unvaccinated adults. It is not. But where we look at the numbers overall, even before vaccines were available, children are approximately as likely to get seriously ill with COVID as they are to get seriously ill with influenza. And it's important to keep that in context. We did not know this at the beginning of COVID. But it's not just about the negative outcomes that we've seen on learning when schools were out of session and all of the other indirect effects. It's that we've got to do risk-benefit analyses here. And at least among children, we have to think of this as similar to flu. You add vaccination on top of that, the risk is even lower. And that is what we are seeing right now. We need kids to get vaccinated, but I remain extremely comfortable with children continuing in-person education. In addition, the other piece where we're talking about schools is what happens with working age adults. I am doing a Facebook Live update this afternoon at 1, and I'm actually going to go through some more data for the young adults and the older adults because I know people are very interested in this. But for the purposes of today, I just focused on 30 to 64-year-olds, our working age adults here in Chicago. So where we look at hospitalization in that group, again, the solid lines are people who are unvaccinated and recently hospitalized in Chicago. The dark green are people who are unvaccinated, 50 to 64, getting hospitalized right now. The yellow line are people unvaccinated to 30 to 49, and then way down at the bottom, risk close to zero is for those who are boosted, and then just slightly above that, people who are vaccinated and not boosted. So we have had 1,250 COVID hospitalizations in this age group, 30 to 64, just since Thanksgiving. That's a lot. But only 3% of those were in people who were fully vaccinated with a booster dose. And where we are seeing that happening, it tends to be people who have really serious underlying conditions. They're fighting cancer, they have a transplant, et cetera. And so since Thanksgiving, unvaccinated Chicagoans, 30 to 64, 35 times as likely to be hospitalized with COVID than vaxxed and boosted adults of the same age. Vaccination, in particular with boosting, does a beautiful job, thank God, of keeping people out of the hospital. Because otherwise, with the COVID numbers we are seeing right now, we would have long since swamped our hospitals. Finally, deaths among unvaccinated adults have increased. Again, you see that in the dark green here, 50 to 64-year-old unvaccinated. That is what is driving our increase in deaths. The dark yellow are recent deaths in unvaccinated 30 to 49-year-olds. Very, very little in the fully vaccinated and virtually nothing in the boosted. I think I failed to mention that the hospitalization risk among working age adults who have received a booster vaccine, it is literally near zero. Okay. How are we then doing on vaccine? Because this is and remains the most important thing. We're above the national average on boosters, but not as much above as I would like us to be. If we look at the population over 18, about 39% of us have now had a booster. If we look at people over 65, about 60% of us have had a booster. I want both of those doubled. Honestly, in terms of protecting yourself right now against hospitalization and death, the most important thing you can do, yes, keep doing all the other things that work, but get vaccinated and get a booster. Our youth are also vaccinated quite a bit higher than the national rates, although we still have a ways to go here too. So if you look overall across the city of Chicago, about 24% of our 5 to 11-year-olds have had a first dose, and about 63% of our 12 to 17-year-olds at the U.S. level. And then here in Chicago, we're about 10 points above that. So 34% in Chicago of our 5 to 11-year-olds have had a first dose, 72% of the 12 to 17-year-olds, and you can see the completed series on the right. So I'm pleased that we're doing well. CPS and others continue to do a lot of vaccination. You're going to hear some more about that. So just a reminder, the best way to protect yourself and others from COVID-19 are the things we have been doing all along, but it is more important than ever that you're paying attention to all of them. First and foremost, get a COVID vaccine, get a booster as soon as you're eligible, as soon as you can make an appointment. Wear a mask that covers your nose and your mouth all the time right now, if you're out in public, to help protect yourself and others. And if people have questions about types of masks, we've answered lots of questions. I'm happy to answer more. Keep 6 feet away as much as you can. Avoid the crowds, the poorly ventilated indoor spaces. Test to prevent the spread to others. I know it's a challenge right now in some cases to find a test. We'll talk about that. Wash your hands. So, related to testing, I want to just talk a little bit about this. It is extremely hard to get a rapid COVID-19 test right here in Chicago and across the country. I want to put this in some context. Why is this true? So first of all, with the supply chain, there just are not rapid COVID-19 tests available. The health department, of course, has had these on order for months and months. We had already distributed about 150,000 of the rapid tests into high-need communities, but as of late November, our supply has dried. We've not received any additional rapid tests despite having orders that are standing. Our understanding of this, as we've been talking to partners across the country, is with the move, the federal move to more centralize and purchase rapid vaccine tests, and supposedly these should be available generally to the public soon, is what we're hearing. It has really dried up the ability for us to have rapid tests available here in Chicago. That's just the truth. I will tell you that we have continued to put the rapid tests we have available into our highest risk settings. Last week, for example, we pushed our last big batch into the homeless shelters, which we're needing to, of course, are high risk, and there's been a lot of work to decompress. But I want you to know, in terms of individuals at home, that I would go, if you've got the means, I would go ahead and order right now some of those home tests. You can order them on Amazon. I keep doing this. It probably takes 4 or 5 or 6 or even 7 days for you to have some available. And I do think they've invoked the Defense Production Act. I do think there will be more available. But it is just a true fact that it is very hard to find a rapid test. If I had more tests available, we would be standing those up. In addition, we are certainly doing a lot of testing and a lot of PCR testing, but with a lot of the threat, a lot of the stretch on the commercial labs that we're seeing across the country, some of you may have experienced it is taking a long time for PCR results to come back. It's sometimes taking 4 and 5 days for that to happen. And that is because the same networks are working on this surge here in Chicago as across the country. And so we've actually worked, especially with schools. CPS, for example, as you know, over break, worked to send home 150,000, I think, of these rapid tests. I know a lot of them didn't come back, and one of the reasons why in-person is important is to have the testing mechanism actually in place to test kids. But regardless, those are precious, and they're being prioritized in settings that work to keep kids and staff safe. In addition, where you look at PCR testing, there's been work not just with CPS, but with the other schools to think about, are there ways to have labs that are dedicated for more rapid testing? So I assume CEO Martinez will talk about it, but some of the PCR testing that's being done in the lab and with the work that CPS is doing is specific with a much faster turnaround time. So you're not waiting the 4 or 5 days, because that's just not that helpful. And you're able to really get those numbers back quickly and act on them. So for the general public, if you test positive right now with any COVID-19 viral test, a rapid test, a home test, a PCR test, I don't care, any test, consider it a true positive. Isolate at home for a minimum of 5 days. Please don't take a home test, and if it's positive, say, maybe it's not, let me go try to get a PCR. We don't need that. Right now, positive means positive. And given that current surge in COVID-19, there is additional pressure on laboratories, so we need you, please, stay at home while you are waiting for COVID-19 test results. If you've got symptoms of potential COVID, but you can't get a COVID test, isolate at home for at least 5 days and until your symptoms improve, even if you're vaccinated. There is still testing availability, but lines are long. And honestly, we're seeing with Omicron, many people, especially if they're vaccinated or boosted, having mild COVID illness, being able to recover without medical care, but we need you to isolate. You think it's the flu, you think it's the cold, assume it's COVID right now. Isolate for 5 days at a minimum. Obviously, seek immediate medical care if you're experiencing emergency warning signs, shortness of breath, you have a lot of underlying conditions, but do not go to the emergency department to get a COVID test. Do not call an ambulance to take you to the emergency department to get a COVID test. We are seeing people do this. And at this moment, when the hospitals are under a lot of stress, you can call our helpline, we'll get you sorted. You may need to wait, but if you're doing okay, just isolate at home. Know Vaccines are available, to be clear. They're over the week of Christmas. I know that there were some people having issues with boosters. We do have a lot of healthcare workers that are out right now, which has also decreased some of that vaccination. And there was some delay sort of in shipping with storms, et cetera. However, they're here, they're available, and you can sign up for, I was looking at it this morning, there's booster appointments available in the next few days. There are pediatric appointments available in the next few days. As always, you can call our number and we'll get you sorted, particularly on the pediatric vaccine, because we were hearing maybe some confusion that it was difficult to get a vaccine for kids. It's not. We've had almost 300,000 doses at this point shipped to Chicago. We only have 550,000 kids, and a lot of those are too young to get a vaccine. We've got 205 providers actively providing vaccine, and we've already sent 663 orders through those sites. So chai.gov/COVIDvax is where you can go to see what those sites are, or as always, call our number. And then just as a reminder, with the new requirement that went into effect yesterday with vaccination and masks still required, there's details on the website about keeping the Vax card copy on your phone. Yes, you can use a physical card. Yes, you can use a picture of your card. Yes, you can use the Illinois Vax Verify system, but you do need to have proof of vaccination. And Mr. Meyer will talk about that. Related to masks, we've been getting a lot of questions. The most important thing is one that fits you and that you keep on. And so we need everybody wearing a mask. That's the most important thing. The mask, remember, the first thing it's doing is source control, keeping your germs with you. You want one that fits snugly. If you've got gaps, you can have droplets leaking out. We've been recommending wearing, if you've got it available, one of the surgical masks with a cloth mask over it. That's a good way to have excellent protection. If you want to be wearing the KN95s, the KN94s, go for it. Those are available, and we're doing additional distribution of those in community. But please know that you need to keep it on. The most important thing is that you wear a mask that fits you, is comfortable, and that you keep on when you're in public spaces. And that's been shown in the studies. Finally, when we're talking about the layers of defense against COVID-19 in schools, I just want to remind you that always we are thinking about the ways these defenses layer on each other. Some of you have heard me talk about this Swiss cheese model, where basically as community transmission increases, you have more holes appearing. If the virus is able to get all the way through the holes, somebody has the potential to get infected. But the first line of defense is vaccination. You see that where we've got the virus on the left kind of moving through. As we have more and more people vaccinated, including in schools, there is less opportunity for the virus to spread. Next, correctly and consistently using well-fitted masks. We didn't even have vaccination earlier on in COVID. That's an additional layer. But the masks remain important. They remain in place. Next is the physical distancing and all of the operational work, cohorting, et cetera. Next is screening and testing, making sure if your child or yourself have symptoms, you are not coming to school. And then obviously the testing that's happening in schools. And then finally, the ventilation. Millions, hundreds of millions of dollars spent on schools around this city working on that. And so all of these become increasingly important, just as all of the things that we're doing in the community remain important. I do want to point you to, again, if you're interested in reading some of the science around why we are so clear about there not being an increased risk of transmission within schools. There are studies that have been done here in Chicago, here in Illinois, around the country, around the world. The CDC science brief here, just updated December 17, highlights a lot of that data. It shows that you can see clusters and outbreaks within schools. In CPS, for example, we have seen some clusters and outbreaks. The average size has been 2.5 cases in the whole first part of the school year. But multiple studies have shown that transmission within school settings is typically lower than levels of community transmission. In the worst case scenarios, we've seen it be similar to levels of community transmission as long as prevention strategies are in place in schools. And this is one of the things that we know when it comes to COVID. So, as always, you have a question, you need a vaccine, you need a booster, visit chi.gov/COVIDvax or call 312-746-4835. And with that, I will hand it over to CEO Martinez from Chicago Public Schools.
Good morning, everyone. Buenas mañanas. Primero, para nuestros padres, quiero que entiendan lo que está diciendo el doctor Arwady. Y les pido, padres, por favor, si tienen preocupaciones, por favor, pueden hablar con un doctor, pueden ir a una clínica o pueden nomás escuchar el mensaje del Dr. Arwady. Si están sus niños vacunados, si están los adultos vacunados, el nivel de riesgo es muy bajo para que personas reciban el virus, de que van a tener que ir al hospital, que algo va a pasar que está más serio. What I just said is that for our families, please, if you have fears, talk to a medical professional. Listen to the message of Dr. Arwady. If you are vaccinated, your chances of being sick as an adult are lower. Your chances of being hospitalized are even lower. Your chances of something more serious happening are even lower than that. And for our children, even if they're unvaccinated, their risks are much lower. The amount of noise that's out there right now, and the amount of information, we have so many people that are afraid, from parents to my staff, because of the misinformation. And again, I just continue to plead, let's listen to our medical professionals. There is no evidence in our schools throughout the whole semester, the whole entire semester, with all the complaints that existed about what we didn't have, the misinformation, that we saw any significant level of any transmission. We just didn't see it. We started seeing cases pick up right before the break. And folks, we moved quickly. We took classes remote quickly. And immediately that was used against those poor families and children in that community to say, look at how dangerous the school is, when it was just the opposite. We were very, very conservative in taking those classrooms remotely. And so I'm sorry, but I can't help but feel frustrated. Just the amount of misinformation that exists, and it's just very important. So again, let me go right to our slides. So again, as I said earlier, there is no evidence that our schools are unsafe. In fact, I hear, because you hear it so loud, I started hearing these issues about filtration, and I had to just ask again. And I even went to our website, and you can go to our website, and you can actually go by classrooms. In every single school, we have our classrooms monitored on a regular basis, minimum weekly, to make sure that if there's any issues with filtration, you can actually go by classroom. And if there's any school that isn't, any classrooms that are in the green, it is not allowed to be used. It is by classroom, ladies and gentlemen, not by building, by classroom. Because the district invested over $100 million as I was coming into the district, into the buildings, into these systems. So there's no widespread issues around safety in our schools. I've been to our schools. Our children are wearing their masks. Why? Because they want to be there in person. They want to be there in person. I was at 6 schools yesterday, and it's sad because I could see the level of fear vary so much across communities based on who people are listening to. I saw schools where, the majority of staff were not present in the building. The majority of children were not present in the building, all the way to the other range where the majority of children were in person. The energy level, how excited they were to be there, to be back from the break. The staff being excited to be back from the break. And so, folks, there is just no evidence, and I just have to keep emphasizing that. One of my biggest frustrations, and I've been very open about this, has been the lack of capacity of testing in our city and for our district, for a district of 330,000 children. It's been one of my biggest frustrations. And we are not an expert in COVID testing, but we have ramped it up. It was almost non-existent when I started at the end of September. As of yesterday, we got 10,000 tests done at 125 schools. We are going to be at every single school 100%. We're going to continue to build the capacity. The home testing, which I'm very disappointed about what the results were, on multiple fronts, by the way. One, that it was so difficult to, the instructions were complicated for families. 150,000 tests, only 35,000 were activated, and again, a very small percentage of those actually became valid tests. Very frustrating. But ladies and gentlemen, it is because I want to provide more access to our families, because I know how high the anxiety is. It's not because the schools are not safe. It's not because I was worried about the children coming back to schools in unsafe conditions. It was because I wanted to reduce the anxiety level. And I'm just disappointed that I couldn't achieve that, but that was the effort. Now with that, we're going to have our lessons. We take our lessons. And one of the biggest lessons that I learned, I can't do these types of initiatives if the schools are not open. There's just no way for us as a school district to execute a complicated initiative if I don't have the schools open, if I don't leverage all of the staff, including my medical professionals. So again, it's a lesson learned, but I'm not going to stop trying to get more access to our families. I am committed to that because I know how high the anxiety is, and whether I like it or not, I am fighting a lot of misinformation. And so the best way I can do that is just to try to give families at least some relief by getting them more access to testing. So we're at 10,000 tests. By the way, our labs are prioritizing them. We already have 1,800 results of those 10,000 tests. I mean, we're going to see those results be turning very quickly, much quicker than what you're seeing. By the way, I went and got my child tested, right before the break. It took 4 days before I got the results, And so again, it's what Dr. Arwady said, and my children are vaccinated, by the way. And so again, it is difficult to get timely results right now, especially with PCR. It is impossible for us to get rapid tests. Not because I wouldn't want to use them. I would love to be able to use them. We just don't have them available, folks. But again, this is something that I call on the entire community, the federal government, the state. We need to figure out how to get more access to testing for our families. Almost 91% of my staff are fully vaccinated. That is a great victory for us. I'm still also another frustration is still how much we lag on our vaccination rates. And I continue to plead for families. And by the way, the good news is we have over 33 mobile events that are scheduled this month. We have all of our 24 clinics, school-based clinics that are open, ready to receive children. We have never had an issue of supply. Never have had it ever. I've never gotten a phone call to say, hey, all these people showed up. We didn't have enough supply for them. We just have not had that. And so again, we're going to be very, very aggressive. One of the reasons why I continue to plead, including with CTU leadership, to keep the schools open and to keep classes going, because that's our best chance to reach families. It is our best chance to get them. Even the vaccinations that we hosted yesterday, I went back at my children's school, it was full. They took all the slots. I mean, we're starting to see more of an urgency, and that's because of the efforts that the city has taken, as well as parents are seeing that, yes, we need to have a higher urgency around vaccinations. So let's talk about CTU, because I know you're going to have a lot of questions about this. I have been in active conversations throughout, the break, throughout even yesterday, with the leadership of CTU, and I have been very, very clear that it is not practical to have a district-wide decision when there is such a variance across our city of how COVID is affecting us. When I have over 100,000 children that are fully vaccinated, over 100,000. Do I wish it was 300,000? Absolutely. But I have over 100,000 children fully vaccinated. I'm seeing such a variance of, and what I'm seeing the most is the fear variance across schools. It just varies so much. And again, it's based on who's listening to the medical information and who's getting the misinformation. That is the biggest challenge that we're seeing. And so, here's a proposal that we've given them. And by the way, these things didn't just come up today. These have been conversations that we've been having with them as we started seeing Omicron coming on. Remember, that came on as we were coming on break. So when somebody asked, well, why didn't you have something like this in the past? We didn't need it, folks. We didn't need it. Omicron cases started picking up, and that's what we started seeing, because everything up to the break, we were seeing very low cases in the schools, very low cases. Now with Omicron, we have to respond. We have to be responsible. So we were able to acquire, with the help of the Department of Health, 200,000 immediate masks now that we picked them up yesterday morning. It's in the early morning. They're being distributed to schools as we speak. By tomorrow, they will be at all schools, and it's for staff. For any staff person that if that just gives them more comfort, our commitment is that we're going to continue to have masks throughout the surge, throughout the month of January, at a minimum. And we will respond and pivot as we need to if we continue to see if we don't see the surge decline. So this is more as again, to reduce anxiety. It's not because our staff are not safe right now. It is to reduce the anxiety. If that's what's going to make them feel better, I feel like I have to respond. The CTO has asked for the daily health screeners to come back. We are reactivating those, and what I've said is that it's up to schools, because in the past, when the health screener was in place, it created significant backlogs of children being able to get into the buildings. We're in the winter, we have the cold months. I'm just worried about lines of children lining up, waiting as we verify the health screeners. But we are activating it, and what I've shared with my principals, and they had meetings with all their staff yesterday. If you want to use it in your school, just talk to your staff, because there's logistical issues. Talk to the parents, make sure they know, because there's logistical issues. And if you want to use it, please, if that reduces your anxiety, go ahead and use it. All of our schools have thermometers. If you want to start taking temperature checks, go right ahead. Again, but I want that to be a school-based decision, because the anxiety level is varying so much across schools. So I want to be responsible. We have a tactical team that is already meeting, and we're going through issues at school. So as we're getting case information, as we're looking at absenteeism for staff, that is already in place. So this proposal we formally sent to the CTU. And again, everybody, for me, more than anything, and I want you to hear this loud and clear, it is not because I have any concerns about the schools not being safe. I am trying to respond to the anxiety that exists right now. And unfortunately, I have to figure out how to reduce it. But that's the proposal that we have. I am convinced, and I've shared this directly and openly with CTU leadership, the best way for us to approach this is at the school level. We can stay nimble. We can work with families. We can make sure that if classrooms have to be remote, then we can make sure that we can respond to those families around specific time frames, getting them access to more testing, helping them return early with negative tests, getting them access to vaccination events. We can do that as long as our schools are open and we have the families with us and the children are in person. So that is still the preferred approach. We have actually submitted metrics based on what we've seen, because by the way, even before the break started, and you saw this, we had over 10,000 children in quarantine. We were already transitioning classrooms aggressively as Omicron was coming, because again, ladies and gentlemen, we're not going to wait for us to see a significant risk of transmission in our schools. We're not going to wait. Principals are authorized today to do that, and they have been doing it. We didn't have to use it. We didn't have to use it very much until, again, as we started getting into the break, that's when we saw an significant increase in the number of children being quarantined. And by the way, at that time, the criticism I was getting, aren't you over quarantine? Aren't you doing it? And I said, yes, I am. I apologize to our families. It is a hardship for our families, but again, we have to be safe. And so that is still in place. So that, I feel, is still the best way to approach it. So the metrics based on staff absenteeism as well as student cases that we have proposed to the CT said, look, let's work at a school level, and that way we can respond to that school. So that proposal has been submitted. So with just in summary, para nuestros padres, quiero que sepan que yo estoy seguro, yo sé que las escuelas están seguras. Todo lo que hemos mirado del año pasado con los casos, siempre los casos en las escuelas siempre estaban más bajos que la comunidad. Y todas las inversiones que hemos puesto en nuestras escuelas, las escuelas están seguras. Pero ahorita yo sé que las familias tienen mucho miedo. Y por eso les pido, por favor, si tienen miedo, si tienen preguntas, primero, vacunen sus niños. Primero. Segundo, hablen con personas profesionales que son médicos, porque ellos les pueden dar la información que es correcta. Again, for our families, again, I know there's a lot of fear. I am confident that our schools are safe. The investments have been made. There's a lot of anxiety. I just plead with our families, talk to medical professionals. Get your questions answered. Again, continue to, just understand what's happening, especially as we're so fortunate to have Dr. Arwady. With that, I'm going to ask the Commissioner to come up. Thank you.
Thank you, Pedro. Good morning. My name is Ken Meyer, and I'm the Commissioner for the Chicago Department of Business Affairs and Consumer Protection. As a reminder to our business community, residents, and visitors, as of yesterday, January 3rd, the Chicago vaccine requirement went into effect to slow the spread of COVID-19 and its variants. The requirement means any individual 5 years of age or older is required to show proof that they are fully vaccinated against COVID-19, to dine indoors, visit gyms, enjoy entertainment venues where food and drinks are being served. Also, anyone over the age of 16 needs to show identification to compare with their vaccination card. As a reminder, the Chicago mask mandate also remains in effect for all indoor public settings. The vaccine requirement is a collaborative effort to standardize health protocols across businesses and industries to prioritize the health of all Chicagoans. As such, the city will enforce the vaccine requirement along with the ongoing mask mandate, just as the city has enforced previous health orders. BACP will investigate complaints received through Chicago's 311 system. Yesterday, our BACP enforcement team investigated complaints, and we saw general compliance, as we have seen with the mask mandate, which has been in effect since August 2021. I know our business community is dedicated to prioritizing the health of our patrons and of their patrons. As a reminder, the vaccine requirement requires establishments to, 1, post signage at each publicly accessible entrance and at least one location in the business informing patrons of the vaccine requirement. And 2, keep a written record describing the protocol for implementing the vaccine requirement that must be available to city officials for inspection upon request. A toolkit for businesses and employers was developed that includes guidance for the written record, signage, checklists, and other helpful resources. A toolkit is available by visiting chicago.gov/COVID. In addition, to provide an overview of the Chicago vaccine requirements, we have hosted 2 webinars with over 500 attendees, and we're hosting another webinar this afternoon at 2 p.m. In case you missed the webinars or are unable to join us this afternoon, you can view them by visiting Chicago's youtube.com/BACP. I encourage residents to contact Chicago's 311 system to report violations to ensure compliance with the current public health orders. I thank Chicago's business community for protecting their patrons and employees by following safety regulations designed to keep all Chicagoans safe. Thank you. And now I'm going to pass the podium over to Dr. Luna with the Chicago Department of Public Health. Thanks.
Thank you, Commissioner. Muy buenas tardes a todos. Yo soy la doctora Arwady and Luna, directora médica del Departamento de Salud Pública de Chicago. Y hoy les voy a traer las últimas actualizaciones del Departamento de Salud. Los casos de COVID-19 en Chicago y en todo el país continúan aumentando. Ahora estamos promediando 4.500 casos diarios en promedio de 7 días en la ciudad. Las muertes 110 diarias y la positividad sigue doblándose a 23% de 13% la semana pasada. En diciembre 28 hubo 7.500 casos, un número récord en esta pandemia nunca antes visto. Seguimos en ascenso. Estamos en un repunte de Omicron. La positividad de la prueba de COVID es la más alta desde la primera hora de la pandemia. Las hospitalizaciones andan en 1.142 al día y el intensivo está en 233 camas por día en promedio, escalando de riesgo sustancial avanzado. Si cree que podría tener o haber estado expuesto al COVID-19, por favor, le pedimos, primero que nada, que se aísle y se haga su prueba de COVID-19. Considere cualquier prueba casera rápida de antígeno positivo y que sea positiva. Si es positivo, significa que tiene COVID-19. No necesita confirmar esa prueba de COVID-19. Si dio positivo en su casa, por favor, quédese en su casa. Si da positivo y está fuera de su casa, por favor, empiece las normas de aislamiento. Si está esperando los resultados, es otra razón, debe quedarse en su casa. Debemos hacer estas medidas para bajar la transmisibilidad del COVID-19 en nuestras comunidades. Pero si no ha podido hacerse la prueba y tiene síntomas, asuma que tiene COVID-19 y empiece su proceso de aislamiento. El proceso de aislamiento comienza en su casa durante 5 días independientemente de su vacunación. Si no tiene síntomas o si tiene síntomas y ha resultado positivo en la prueba de COVID, debe permanecer en su casa 5 días sin salir y tiene que continuar usando la máscara después de esos 5 días para bajar la transmisión. Si tiene fiebre, continúe quedándose en casa hasta que esté libre de fiebre. Los beneficios de la vacunación y los refuerzos de vacunación son increíbles. Continúan brindando la protección máxima contra las hospitalizaciones y los resultados graves del COVID-19. Los niños han visto un aumento en la tasa de diagnósticos de casos de COVID en aumento, pero más bajo que los adultos. Es importante saber que estamos enfrentando una nueva variante, Omicron, mucho más transmisible y ahora se empieza a reflejar en nuestros niños. Pero los casos de niños siguen siendo mucho más bajos que los casos de adultos. Las hospitalizaciones infantiles por COVID-19 siguen siendo menos frecuentes y se ven en los niños con condiciones de salud. Padre que me escuchas y tienes niños con condiciones de salud, el momento de vacunarlos y protegerlos es ahora. COVID-19 diaria, los casos diarios son mayores en niños de 0 a 17 años, pero mucho menos que lo que vemos reflejado en la comunidad para adultos. Estamos logrando un buen progreso en la vacunación infantil, muy por encima del promedio nacional, pero todavía queda camino que recorrer. En toda la ciudad, 72% de los adolescentes de Chicago han recibido su primera dosis y 34% de los niños de 5 a 11 años. 34% es un número muy bajo para una vacuna que está ampliamente disponible y los casos de COVID aumentando en nuestros niños. Cuando se trata de escuela, los datos muestran que las escuelas pueden y deben seguir abiertas de manera segura con mitigaciones apropiadas de múltiples capas que incluyen enmascaramiento, distanciamiento y quedarse en casa cuando esté enfermo. Hemos visto casos de COVID en las escuelas de Chicago que han reflejado las tendencias de transmisión en la comunidad, pero siguen estando muy por debajo de la transmisión comunitaria. Los salones de clases siguen siendo el lugar más seguro para tener a nuestros niños. Los datos muestran que los estudiantes contraen COVID fuera de la escuela con mucha más frecuencia que cuando se encuentran cursando en sus salones de clases. Desafortunadamente, el virus no se detiene en la puerta del aula. Y al salir de la temporada navideña, con la nueva variante que es mucho más contagiosa que las anteriores, Omicron, es más crítico que nunca que todos los niños reciban su vacunación. Continuaremos monitoreando los casos de COVID-19 dentro de las escuelas. Esta comunidad escolar es única y las investigaciones y respuestas de casos de COVID lo tienen en cuenta. Recuerde que el mandato de la salud de la ciudad requieren que ciertos establecimientos verifiquen a todos los clientes, incluyendo niños de 5 años en adelante. Si quieren seguir disfrutando de una ciudad abierta y llevar a nuestros niños, tienen que considerar completar las vacunas. Obtenga más información de dónde se aplica la orden y qué formas de verificación de vacunas se aceptarán en chicago.gov/COVIDVax. Y repito, chicago.gov/COVID. Lo mejor que podemos hacer para protegernos a nosotros mismos y a nuestra comunidad del COVID-19 es vacunarnos primero, tomar el refuerzo si ya es elegible, enmascararnos, seguir un distanciamiento de 6 pies o más, lavarse las manos con frecuencia y hacernos las pruebas de COVID-19 si cree que se expuso, si va a reunirse o cuando se siente enfermo, aunque sospeche que sea de otra condición de salud. Todos debemos hacer nuestra parte y la vacunación sigue siendo el arma más poderosa para contrarrestar esta pandemia. Si tiene síntomas, por favor, quédese en casa. Se lo pedimos encarecidamente. Si cree que tiene catarro, tiene COVID. Si cree que tiene influenza, tiene COVID. Tiene que sospechar que es más probable que tenga COVID que tenga cualquier otra condición de salud. Las personas pueden encontrar pruebas a través de su proveedor de atención en hospitales, farmacias, sitios comunitarios, a través de Roche y Esperanza. Para más información, vaya a chicago.gov/COVIDVax o llame al 312-746-4835 para información y citas, y para visitas al hogar. Todavía los incentivos de $100 están para todos aquellos que no hayan recibido su vacuna. Las pruebas de COVID también son gratuitas, llamando al número, y para más información y la ubicación de nuestras clínicas de la salud, acuérdense, 312-746-4835, y en un abordaje de la equidad, las vacunas siguen siendo gratuitas para todos independientemente de su estado de inmigración o si tiene aseguranza. Cuídese, Chicago, y feliz año nuevo. Ahora le devuelvo mi micrófono a la doctora Arwady. I give back the mic to Dr. Arwady.
Whose questions per reporter? Start with Sarah.
Hi. Is this on?
Yeah.
Okay, good. All right. My first question for Dr. Martinez is, have the metrics that you're proposing, it includes saying how many teachers would be absent and then that would close down schools? And would there be any contingency on a school that doesn't want to use it, or any discretion by the school?
Yeah, so great question. So the metrics include both staff and student cases as we see a minimum of either that we start looking at it. And so the way it's been working, because again, it's already been we've been actually operationalizing this for a while. We just have never had to do it at a school level. Is that we start seeing cases with staff. And so, for example, the metric that we talked about once we start seeing like a 25-30% level of staff that are actually infected, that's when we and usually we have never seen it where it isn't both together. We usually see staff, and then eventually we start seeing student cases as well. So both metrics include both, and we have empowered the principal to do that. And so what I've been sharing with CTU, and they've seen it, is that what happens is it isn't all at once. Is we see classrooms starting to go remote, and then we see more classrooms, and the only thing we're doing is formalizing, saying, hey, once we have this level, we just need to have the whole school. So rather than just waiting for more classrooms to come in, and so so we'd be even a little more conservative than we've been in the past.
And my second question is, let's say this does not prevent the union from voting today to go all remote starting tomorrow. What will you do if they go all remote?
So again, we are still committed to trying to get an agreement. I feel it's a much more practical approach. Frankly, it's a lot fairer for our families, because we have so many families that are vaccinated, so many families that went and got negative tests before they came to school. And so if none of that works, The one thing, and we're going to send a message to parents later this afternoon about this, I will have to cancel classes tomorrow. It doesn't mean that the schools will be closed. The schools will be open. But I will have to cancel classes tomorrow because I have to be responsible not knowing who's going to be showing up to the buildings. And then we will have a plan specifically for parents that will come out tomorrow in a very timely fashion about what the path forward is. I am still committed, though, to coming up with an agreement with the CTU. I think the approach we're taking, we're being responsive to the requests they've made. We're trying to be practical for what makes the most sense for our district, especially a district of this size with such unevenness of COVID.
So you won't let them go all remote? You won't let them log into their remote classrooms?
2 questions. Thank you. Thank you.
Good morning. I have a question, well, 2 questions. One is for CEO Martinez. Just so that we can go back to those metrics, since we've been talking about that. Do we know today what percentage of your staff overall is absent and what the total number of classrooms are across the board that are remote?
Yeah, let me get you those specifics. Yesterday I can tell you that we had, including staff that were on leave, which is about 600, another 3,200 above that, 3,800 total that we didn't have teachers present. Now that includes 600 on leave, so 3,200. And our attendance was also lower. We're still getting the final attendance numbers. We were able to cover all the classrooms. So that wasn't because, unfortunately, the way it works is you'll see a school with less staff showing. You also have a lot less children showing as well. And so it creates logistical issues for our schools, but we've been able to do that. We have very few children that are on remote. But again, remember, right before the break, though, we did hit over 10,000. And so my expectation is that we were going to start seeing those kind of numbers again, if not higher, as we were coming into the breaks. And remember, we just did 10,000 tests today. We're getting the results very quickly. So we're going to have results, I'm pretty sure, sometime today for all 10,000 tests, and then we'll start acting on that as well.
Thank you. And the second question is, it's probably either Dr. Arwady or Mr. Meyer, and maybe both of you can address it, regarding the pop-up testing sites that we all see, and a lot of them look a bit sketch. And so the question that's arisen with us is, who receives them, and how do consumers know that they're legitimate?
Yeah, absolutely. And we certainly have gotten questions about that, so happy to take it. And if you want to add, you can. So first of all, I want to reassure people that even pop-up testing sites are using FDA authorized tests. And in many cases, they are using the same test that you might be using in your home if it is a rapid test, or if they are taking a sample for PCR, the laboratory work is not happening at that site. It is happening at a separately regulated, overseen site. And so overall, we've not seen major issues with inaccurate tests, for example, in those settings. I know a lot of them have popped up in outdoor settings. We actually kind of like that from an infection control standpoint. That said, if people have concerns, these are regulated at the state level. There's information on the website for how you can report that in if it needs to be looked at. But I want to reassure people, I think what we were seeing a lot of is people testing positive and thinking, oh, I'm vaccinated, how could I be testing positive? And their minds jumping to probably this isn't a good test. Let me reassure you, they are good tests. And this is different than early on in COVID, where even the sampling was harder. It was, that you had to do the deeper swabs in the nose. There was much more specifics to it. These are not sites that are, doing neurosurgery. These are sites that are collecting samples in a way that is meant to be pretty straightforward, and then doing the work to make sure those get transported to labs. So I don't overall have concerns about inaccurate tests, but certainly if people have any concerns about them, they should report them through the state, and there is information on the Chicago website for how to do that. Do you want to add anything? Or okay.
Is there something to look for at this site that says that it's regulated or legit?
Yeah, so what I would encourage, if people feel unsure about it, I would ask the question, are these tests FDA authorized, and which laboratory are you sending test results to? If you get a sense they can't answer those tests, that would obviously be a big red flag. If you're seeing, and in most cases where we've looked at these, you're seeing the box they're using, you're seeing the details. early on, we had a problem with testing sites sort of standing up, kind of the Wild West of testing, if you remember. People were using tests that were not authorized. That is not the situation that we are seeing here. So again, I don't have a big concern for inaccurate tests coming from there. But I, again, people can look if they have additional questions.
Thank you, Dr. Arwady. Do we have enough information right now to say when Omicron will peak?
So we don't know for sure. Let me tell you how we're thinking about it and have been talking to the modelers and the epidemiologists. So in South Africa, which was the first place to really detect and see this huge surge of Omicron, it took about 4 weeks for Omicron to peak, and then another couple of weeks for it to really come back down. Now, South Africa differs from the UK and Europe and from the US in a number of ways, including high rates of prior infection, differing rates of vaccination, a much younger population with a median age under 30 there, and so just a different population overall. So in a best case scenario, we would be looking probably at a peak in the first half of January, let's say. However, I do want to put a caveat that we are watching really closely what is happening in Europe and in the UK, because sort of after seeing that surge in Southern Africa, the next place we really saw Omicron surge was in the UK and Europe. We have not clearly seen yet a sign of decrease in those settings. It's always a little bit tricky around the holidays because testing just gets disrupted in different ways. We have definitely seen signs of slowed increase, which we have also seen here in Chicago, but I will feel more reassured when I start to see some of those numbers come back down. So what I'm hoping is that we will see numbers in Europe over the next week or two start to come down. New York's a little bit ahead of us on this too, so we'll be watching for that, and I would expect a week or so later. So I feel, based on just talking to everybody and the scientists who are looking at this, I feel about 85 to 90% sure that we will peak in January. And I feel about 50% sure that maybe we'll peak in the first half of January. But we'll see. And we'll know much more in a week or so, I think, particularly looking to Europe. But in the meantime, now is this time to get vaccinated, really, truly, and especially for protecting the hospitals.
A question about testing and how we should think about testing.
Yeah.
Is it only if I've been exposed then I test for a number of days afterwards? Or should I be testing once a month, whether I've been exposed or not, just to see what's in my system?
Yeah, so, and I know this has been hard for folks to navigate a little bit, so I appreciate the question. One thing I would say is, if you have symptoms right now, there's a good chance it's COVID, but you can't know that for sure one way or another without getting tested. And so having people go and get the testing is part of seeing that high positivity. We know those are folks with symptoms, high risk, et cetera. Those are folks who we want to get tested if they're having symptoms, especially if you're unvaccinated because you're at high risk of getting seriously ill. We want to know that sooner rather than later to get you into care, to get you, treatments, et cetera. But for everybody else, if there has been an exposure, right? So if you, get a call that your close contact has tested positive for COVID and you just had dinner with them a couple of nights ago with the mask off, that is also an important setting to try to be seeking testing. And that's where I encourage people, if possible, we have been top of the line for requesting rapid tests, both from the commercial and on the federal side. But I have been all through the pandemic, every week or two, I order a few more tests just at my own home. And if I ever have an exposure, or ahead of when I'm going to be gathering, or perhaps seeing somebody who is higher risk, I may use it in that setting. We're not at a point where we need to be just testing everybody all the time. I truly believe that. And right now, frankly, when COVID is as high as it is, the testing in some ways is less important because where folks have symptoms, you just assume that it is COVID and treat it as such. What I don't want folks doing is feeling ill. Maybe they don't have a home test right now, going to get a test, it is taking sometimes 4 and 5 days to come back. I don't want them just out and about and waiting for that. So really right now, and this is the same guidance that's being given across the country, is to COVID until proven otherwise. And so if you need to prove otherwise, that would be a good reason to do it. And then I think settings, like schools, we are obviously so committed to keeping essential services going, and essential services very much include schools. And so we are, in the same way that we've prioritized the testing for homeless shelters and group settings and prison settings and, the areas that we know to be high risk, we also are very much, prioritizing access and doubling down on all the other things that work. But I don't want people to confuse testing with that's good enough, because it's not. If I could choose between just having a vaccine or just having a test, I would choose a vaccine every single time. If I could choose between just having a test and just having a mask, I would choose a mask every single time. What the test is doing is just detecting that you're already infected. It doesn't actually prevent you from becoming infected. Obviously, we use it to alert people, around us, and there is that important for public health. But nevertheless, testing is not a substitute. The vaccine is working well, but we just need folks to get it.
Heather, WTTW.
Thanks. The school year started without a safety agreement between the CPS and CTU. In retrospect, given what we now know, was that a mistake for parent certainty and a continuity of operations?
That was not a mistake. I've said this from the beginning. I will work with anybody as long as we prioritize the interests of families and children. It doesn't matter who it is. And different groups have different roles, and I respect the CTU protect, their roles to protect our staff. I think that's a good role. The reality is, though, when you look at the evidence, first of all, the most important thing we did as a district is we partnered with an amazing asset with Dr. Arwady and her team. Every week we have conversations. Every week we look at cases. Every single decision we make related to schools is in consultation with the department. That is the best decision we made. It was a great decision to invest in the schools, in the filtration systems. It was a great decision to have masks available for every single child, for every single staff person. It was a great decision to prioritize vaccinations for our staff and actually to ask every staff to get vaccinated. All those decisions have paid off. There was never a need for any kind of agreement. I think the challenge, what I wish, if I had a magic wand, I wish all of us were providing good information to families. I wish all of us would actually work together to say, okay, let's figure out how to vaccinate more families. Let's figure out how to, test more children. But again, what I see instead is, just misinformation that's out there. And look, and I'm not, this isn't, COVID is the enemy, not the CTU, not us, but it is. I mean, I wish we could, we could all be on the same page providing accurate information to our families, because I'm seeing the fear. I'm seeing the fear with our families. I'm seeing the fear with my staff with 91% vaccination. And so, and I understand, look, I'm a father myself. I feel the most helpless whenever my children get sick. 11-year-old and I feel helpless. I mean, I understand that feeling and what it feels like, but when I see the information, and because my children are vaccinated, parents have a way, and we will be there with them. We will, again, we're going to ramp up our vaccination COVID events. If that's what it takes, we'll continue to do that. And with the commissioner's decision and the mayor's decision to put more restrictions in the city, I think we're going to see actually hopefully more families having a higher urgency for vaccinations.
Can you be specific about the misinformation that you see spreading out there? And do you believe the Chicago Teachers Union is a source of that misinformation?
I think Dr. Arwady is a better person, because there's a lot of misinformation by Dr. Arwady everywhere. I don't think it's coming from one source. But the biggest misinformation that I see right now that I can tell you is complete myths about our schools being unsafe. Complete myths that we're seeing high levels of transmission across the schools, across classrooms. Ladies and gentlemen, Dr. Arwady, who has, she would tell you directly if we were having and seeing significant outbreaks of schools, we'd be closing schools. I mean, there would be no hesitation. That's the biggest misinformation that I continue to see.
Can I ask you to answer the second part of my question?
No, I did. I said, I don't.
Do you think the teachers union is a source of that misinformation?
I think there's a lot of sources of misinformation. I'm not going to question any motives. I think there's, you can go on social media, everybody. You can see the information that's out there, and you can see what's not consistent with the science.
Anyone else?
Sorry, also for CEO Martinez. I know, again, we're dealing with hypotheticals, but just for parents who would like to have a plan A and a plan B for tomorrow, the buildings will be open. They can bring their kids. Can you just clarify all that?
Yeah. So, still right now, this minute is my goal is to come up with to have hopefully a reasonable agreement today with the union. I've actually asked the leadership to delay the vote. Doesn't mean they will. They have a proposal. We actually have a regular meeting, by the way, on Tuesdays. So I mean, there's a method to this, right? It wasn't just a random submission. And I've been having conversations with leadership throughout all of last week and even as early as yesterday. So the communication has been going on. What I can tell you right now, if and I want to be fair to parents, and I hate being put in this position, but if they do take a vote to do a walkout tomorrow, I have to cancel classes. I have to be responsible. I am not closing the schools. The schools are going to be open. And so again, all staff will be welcome to come to school because we are going to have a plan for our families. I am not going to let our parents down, but I also have to be humble that, at this point, the misinformation and anxiety is so high, and I saw it firsthand as I was visiting schools. I wanted to get a sense myself what I was seeing, and like I said, in some schools, it is just at an extreme level, to the point where there is no logic behind it. There's no science behind it. But fear is fear. Right? I can't control. I mean, I can't just automatically press a button and have people's fears gone. And if you sense any a little bit of frustration, I mean, that's my biggest. Is just because I feel for those families. We know, ladies and gentlemen, who are the children that are going to get hurt the most when they have less in-person instruction. It is our children of poverty. It is our children who already have less, who already are coming in behind. We had 100,000 children that were disengaged. We were able to bring them back. They were doing so well in the first semester. They were coming to school every single day. And then now we throw this uncertainty back to the families. And you know what? I'm sorry, but to remove the choice for families. I respect families who said yesterday, you know what? I'm a little scared. So, CEO, if you don't mind, we're going to keep our children at home. I can work with those families, right? We can work with them. But not to give them the choice, I'm sorry. I just don't think that's right.
Okay. One more follow-up. If they vote to go fully remote and the teachers try to log in tomorrow, I guess what happens at that point? Are they locked out? Will anything happen?
Well, what I can share with you again, classes will be canceled. Schools will be open. We will have a plan tomorrow, but it's going to be. I mean, we're going to create the plan that's best for families and students, not based on anything else. And so, what I can commit to families is that if they take an action to do a walkout, I have to cancel classes tomorrow. I'm sorry about that. You will have a plan tomorrow that you will see how we move forward.
Deadline by what time you'll make this decision?
Well, the vote, as I understand, is happening between 6 to 9. Again, they've set all those parameters. I mean, unfortunately, I don't have any control of that.
Anyone else? Mauricio, can you get talk to me?
Question for CEO Martinez. You said that you asked the CTU for a delay in the vote. What was their response?
I even offered, just to give you a little bit of inside baseball. I mean, I even said, look, I'll even talk to your membership because they're having, these large meetings, and I'm happy to look, they want to yell at me, they want to vent at me, please go ahead and do it. Because my goal is just give me a chance. Let's figure out how to reduce your anxiety. So the response I got was, in general receptive, but not committing to anything. And unfortunately, there's just a lot of anxiety out there, and they have a lot of energy that's been worked up, and my fear is that now it has to take its course.
Just wanted to clarify a couple of questions. So classes will, if there's a walkout, classes will be canceled. So does that mean that students won't be able to log in remotely?
We would have to cancel complete instruction in classes because I have to develop a comprehensive plan for families, and my commitment is they will have it tomorrow. But I can't do something just haphazard. Because at the end of the day, the commitment I have to families is I have to have a plan that's going to prioritize them and their children. It can't be prioritizing anybody else. And so I don't want to be in this situation. I feel for my, right now the emotion you're getting from me as a parent as well, not just as the superintendent CEO, but we will have a responsible plan for families that we will have tomorrow. The schools will be open. And we're gonna build a plan for the families, but there won't be any instruction, there won't be any classes, because I have to be responsible in how we're gonna serve our families.
And are you guys negotiating today?
So we have, first of all, we've been in conversations all along, but formally there is actual formal meetings every, twice a week, including Tuesdays. And so that's part of the process that we've had since, forever.
CEO Martinez, on the issue of testing, and Dr. Arwady too, if you want to weigh in, we've seen other districts do mandatory testing to return after winter break. Illinois education officials aren't preventing that. There are Illinois districts doing that. There's other districts around the country that have gone to closed this week for a couple of days to do some testing. Move to opt-out testing instead of opt-in. Are any of those options good in terms of reducing anxiety, like you said, to be able to get testing ramped up?
Yeah, so I'll speak maybe generally, and if you want to add anything, you can. So, First, I just want to start with saying testing is important, but it is not the most important thing. And, to this question around just some of the information, I have talked to folks here in Chicago who think that there is no testing that is happening in CPS schools, just to give you a sense of this. And every single school has testing in place this week, right? And right now, CPS continues to require the consent from parents or staff to test in school settings. And I understand those numbers have been going up, and I know certainly encouraging folks to sign up for that. We've been having some of these conversations. But what I can say is that all around the country, there are definitely challenges with testing. And there are not very many settings that are having conversations like we're having right here. There are certainly, for operational reasons, there have been some decisions, around the country where numbers of staff, students, et cetera, are out, just like we're talking about at the school level here. But the thought around not returning to school, where it's been shown, like, over and over again, that in fact, when kids and staff are not in school, they have a higher risk of COVID, right? That's just, we saw that right here in Chicago in the sort of natural comparison that we had when CPS was out last fall and our other private schools were in. And we saw lower rates of COVID infection in both staff and students, the ones who were in school. And there's a lot that remains unknown about COVID. If I knew that this were going to peak tomorrow, it would be an easy decision. We don't know for sure when Omicron is going to peak, but we know that being in school does not increase that risk. In fact, in the studies, it tends to decrease it. And we know that school is essential. And at some level, we are living with COVID, and we have to do that. Where people are vaccinated, I want people to be able to go about their lives. And it worries me, not so much the thought of a few days, but it worries me what could happen here. If we go into a week and another week and another week, and we've got kids out of school, potentially for long periods. Worst case scenario, I am very hopeful none of that's going to happen. I think what CPS, has put forward is very reasonable. I worry a lot about what happens next because we are not yet recovered from the negative effects that we saw from so many kids trying to learn remotely. And it's my job to think about health broadly. And health broadly, especially for kids, yeah, it's protecting from COVID, but are they in settings that protect their physical health, promote their mental health, make sure that they are emotionally developing in the way that they need to, that they're having the social interactions? And it is, people around the country they just say to me, like, what is going on in Chicago? Our schools are all demanding that we should take the masks off, and you're not wanting to come back. And again, I understand that people are scared. I understand that you're looking at those numbers and seeing that they're high. But I want to just reassure you that, especially if you're vaccinated, your child is vaccinated, this is behaving really like the flu, and we don't close school districts, especially for extended periods of time, for the flu.
CEO Martinez, well, this is just the same question. If you can answer that and just touch on the part of the question about anxiety. I mean, what are the obstacles, if you're trying to lessen anxiety, what are the obstacles to mandatory testing to return?
Yeah, so first of all, I just feel those decisions always should be done with our medical professionals. And so, that's always been something I've asked our medical professionals, not only here, in other districts, and always the advice I got from medical professionals, it should always be an opt-in. Parents need to want to do these things. And really, for me, I think, again, it's what we've said earlier. A test is not going to help you. Yes, maybe can it reduce anxiety, just like maybe wearing, for our staff, maybe KN95 masks. It's still not going to protect you. It's going to be getting vaccines. And I can't help but continue to pose the question. If we're that scared, why aren't we seeing, lines everywhere to get vaccine? I mean, we're having this conversation about closing schools. Restaurants are open, theaters are open, events are open. We're here in this room in person. Again, and all the data has been very clear, and we've shown it in our own district. The children are safe and are safer in schools when we look at COVID cases in the schools versus the community.
And for my second question, is this the one? Yeah. The district spent a lot of money on new Chromebooks right before winter break. Do you have plans to distribute those if this gets extended past a day, 2 days this week?
Yeah. So again, what I can tell you is that we are going to be a responsible district, and we will have a plan. We bought 100,000 devices over in the month of December. One, because I wanted to make sure that one, we'd be ready for anything, not knowing what could happen with Omicron. Two, frankly, I want to make sure our children have access to high quality devices. It's time that our children, we need to continue to raise the standard of how we serve our children. And so that's why I'm confident, regardless of what happened, we will have a plan tomorrow. But again, I apologize to families again. If this vote goes the way the CTU wants it, I will have to cancel classes tomorrow just so that we can regroup and build a responsible plan, and then we will have a plan to make sure that parents will have it tomorrow.
At what point would remote learning?
All right, thanks, guys. Appreciate it. Thank you.